evening, everyone. Let's start with today's session. Is my audio and video clear? Can I have a thumbs up from anyone, please? Yeah, thank you, doctor. Probably the Saturday fever is there. Nobody has very less focus. Let's start with today's session. Guys, we'll be seeing around 15. So we'll be seeing around 15 recent advances question. Basically the OSCEs, which some of them which have already come, and a few of them which are likely to be asked in the coming exams. Okay, along with the potential other OSCEs related to that particular question. Okay, and we'll be taking around 35 to 40 minutes. I've kept it short so that you can go ahead with your other plans. So let's go ahead. If anyone has any difficulty in any problem, please let me know. Okay, let's start with today's session. Sorry, I just forgot to make it to the first slide. Okay, so as we decided last time, we'll be starting with the lasers for the exam. So the question is being asked is ki you see the image given below and answer the following questions. First is what is fluence threshold, then what is laser safety, so what is fluence threshold, what is laser safety, and they're asking us 2 uses of lasers in ENT. Okay, so first thing is ki generally out of 20 questions, there will be one question where they will be giving you some image, some acronym, and they'll ask you what does it denotes. So we'll be discussing 2-3 of the image-based question of similar kind today. So one of them will be laser. Okay, remember the full form of laser, that is important for you guys. Then see this thing, what is fluence threshold? Basically, this is a definition based question, that this is the minimum energy per unit area required for laser induced damage. Basically, that is like at the minimum point from where the laser starts damaging the surface. Now, there is one more related question over here, that there is something called as laser fluence. Has somebody heard of it? Laser fluence? Let's see. Laser fluence. So, what is laser fluence? This is the energy density at the illuminated area. Energy density at the jahan pe laser is working, at that area, what is the energy density? Both questions can be a probable. A minute, please. Okay, so we were discussing, guys, what is the image about and the associated questions that can come. Okay, so this is the fluence threshold. Somebody else. So the first is what is fluence threshold? This is what we saw. And second associated question is something called as laser fluence. So this is laser fluence, that energy density at the illuminated area. Now, can somebody help me? What is laser safety? This is exactly from Scott Brown. Anyone? Any 1 or 2 points? Okay, so we'll only discuss it if nobody else is answering. Okay, third is your laser safety, and we'll discuss it in the next slide. Okay, now anyone with any uses of laser in ENT?
Stepidotomy, sir. Laser assisted stepidotomy.
Exactly. Anything else?
Microlaryngeal resection. MLS.
Yeah, great. Bilkul. Okay, so Dr. correctly answered. So this is like if they are asking you, like here they are asking only 1 or 2 uses, it's better. Like suppose you get this question in the Viva. Okay, so there is one way of answering this way only, sir, like whatever 3-4 uses comes into your mind, you can answer. But for answering in Viva, it's always better to organize your answer and then say. यहाँ पे तो you can answer anyway, it's all correct, you'll be getting 1 or 2 marks for that, you'll get full marks. But supposedly this question comes in the Viva. So what my take will be, first to divide it, ठीक है, कि otology में what are the uses, then in rhinology what are the uses, in larynx what are the uses, and then answer. See, you know the answer, it's not that कि आपको you are not knowing the answer. The point is to organize those answers, one, and second is to make the examiner know that you know the answer. So otology में you will write, sir, this is stapes surgery where you can use it in myringotomy, you can use it in multiple other places. Same goes in rhinology, you can use it in reduction of turbinates. Okay, you can use in some of the sinusitis correction. In larynx, you can use it for vocal cord lesions, polyps, etc. You can use it for malignancies, initial stages. Okay, so if you organize it this way, it's the same, nothing else is different. It will give you a better approach to the question and a better standout from the as compared to the other people. Now, related to this thing only, the next question is, see this image. Can somebody identify this gentleman? There are only few places where Indians are ahead of everyone. Like
Kumar and Patel, sir?
Yes, doctor, absolutely correct. C. Kumar and Patel. Just a minute, doctor. 1 minute message. Okay. So he is C. Kumar and Patel. Remember him. It is important. This CO2 laser was invented by him. He is an Indian, so that's why it's a possible question. And second question is, what is the wavelength of CO2 laser? Third question they will ask you, what are the uses of CO2 laser? Okay. So uses mein you can write this only, like stapes surgery and all, we use the CO2 laser itself. Now, what is the wavelength of CO2 laser? Can somebody help me?
10,600 nanometer.
Thank you, Dr. This is absolutely correct. So please remember it. Of all the lasers, CO2 laser is the most important for you, followed by the other people. Okay. So remember this question. Now coming to this third thing. This is the laser safety that we were talking about. This is from Scott Brown. Go through it at your own leisure. But ये पता होने चाहिए. 2-3 points should be at your tips. Now coming over here. See, this is a laser safety tube. 2 things to be seen over here is, first is this. There are 2 bulb for that, and second यहाँ पे जो इन्होंने ये किया हुआ है, that is basically the Morphy's eye which they have highlighted. ठीक है? Okay, so 3 things. Now coming to this, see, this is what we saw just now, that this is the image of laser. Okay, now similarly there are few other images which can come and like if they are asked as ABCD, identify what is ABCD. So it might become a little bit of hectic thing. So I had put all these 4 images in one slide. This is your radiation hazard, this is your biohazard, and this is your cytotoxic waste. How they can ask this question? They can give all the 4 images like A, B, C, and D. चारों दे देंगे, and नीचे they will ask you कि what is the image for laser. So like if you have not seen it once or twice thoroughly, likely to get confused type है. ऐसा नहीं है कि आपको आता नहीं है. You know that answer, but it is a potential point where you can get confused and they'll make you answer it wrong. Okay. So moving ahead to the next part. Now this is the image given to you. They are saying this is the image, and they are saying what procedure is being performed and what all thing is there. Can somebody take a try? Something related to laser only.
Laser assisted uvulopalletoplasty.
Exactly, doctor. ठीक है. So this is laser assisted uvulopalletoplasty. We will see these things again when we will be seeing the OSA surgeries and the OSA parts. But here, just because I was collecting all the laser questions, so that's why I put it. Please remember this image. This can come in your exam. You can see the dots which they have put, both for giving the anesthesia as well as for putting the laser, and the corrugated margins over here. Now, again, this is, I'll say, from the boring part of here. Now, this image, this is NPPCD, National Program for Prevention and Control of Deafness. NPPCD. Okay, this is important. Now, this image is World Hearing Day. This is the image of World Hearing Day. Now, can somebody help me and tell when is the World Hearing Day celebrated?
3rd of May.
3rd of, थोड़ा सा correct है, थोड़ा सा wrong है, 3rd of March. Yeah, it's 3rd of March. Now, third question which might come, because like DNB is known for that, like screwing you from all angles. They can ask you what is the theme of World Hearing Day. I know it's a PSM question, but एक बार just देख लो, it might come in handy. So this was the theme of last year, changing mindset. ये जो theme है, this is of 2025. Okay. Now for 2026, they have a little certain थोड़ा सा different है. This is from communication to classroom. From communication to classroom, hearing care for all children. ठीक है, please एक बार just note it somewhere, so it will help you if in case you get the same question. Now third image is this HLAA. This is the logo for Hearing Loss Association for America. Okay, this you will find it at multiple places. And here only one thing from my side, please remember that there is an image of that newborn being screened for the OE. Hai na? This image, I'm seeing it consistently every year. I've just kept it for future discussions. But whenever you read OE, please revise it. It is like a short question of har saal pooch rahe. Last 3-4 years, every year it's coming. Okay, so all three images we have seen. Now let's see this practice question. I'll require your help to answer it. They are giving you 4 logos, A, B, C, and D, and they're asking you identify the logo for program for deafness in India and what is the full form of the official program. So what is the answer?
C. Image.
Absolutely correct. एक नंबर इसका आधा नंबर मिल गया. Now full form for this official program. Now we try karo. We just saw it's like a slide before.
National Program for Control of Deafness.
National Program
for Prevention and Control of Deafness.
ठीक है. I also forgot. ठीक है. National Program for Prevention and Control of Deafness. ठीक है. So पूरे एक नंबर के लिए we have to write all 4 points. National Program for Prevention and Control of Deafness. ठीक है. Remember it. It's important. ठीक है. This is I think 2-3 sessions back का ये OSCE है. Actual from DNB OSCE only. Now when was this program started? This was started in 2007. Ratification है. There's nothing else to be seen over here. And which government agency is responsible for this? This is Ministry of Social Justice and Empowerment. Now this third part, the components. This is a PSM question. Okay, this is a PSM question. And what are the components? They are giving 2 marks for this. So एक बार देख लीजिए. This is capacity building. No scientific thing in it, but just ratification till you pass your exam. Capacity building. Manpower training. Service provision. Awareness. And there is one very interesting term called IEC. Anywhere in PSM and in community medicine, if you don't get what to answer, write IEC. That is Information, Education and Counseling. तो most of the एक number वहाँ पे मिल जाएगा. ठीक है? So please remember it. This is important, likely to be repeated. Now, easy image. This is the image which is given to you. Okay, and they're asking what it is, what is the mechanism of action, give one use. So, can somebody help me? What is Ebola parasite? This is a human
Clonal antibody.
नहीं कौन सा एंटीबॉडी?
Parathormone.
ह्यूमन पैराथॉर्मन एनालॉग नहीं, एंटीबॉडी नहीं है. एंटीबॉडी वाले देयर आर 4-5 क्वेश्चंस जिसमें मैप आएगा, फेटुक्सीमैब, बेवासिजुमैब, विल सी देम. ठीक है. सो दिस इज एबोला पैराटाइट, लिटिल बिट डिफरेंट. ठीक है, प्लीज रिमेंबर इट. ठीक है. नाउ व्हाट इज इट्स यूज? इसका यूज है, दिस इज यूज्ड इन मेन ऑब्लिक पोस्ट मेनोपॉजल वीमेन. मेन में भी यूज करते हैं एंड कॉमनली यूज्ड इन दी पोस्ट मेनोपॉजल वीमेन, दोज हु आर एट रिस्क या जिनको आपको हाई या सीवियर ऑस्टियोपोरोसिस है. ठीक है. तो दिस इज फ्रॉम योर कैल्शियम मैनेजमेंट चैप्टर फ्रॉम स्कॉट ब्राउन. दिस क्वेश्चन कैन कम. सो रिमेंबर द नेम एबोला पैराटाइट. ठीक है, दिस कैन कम. Basically, it acts on the PTH receptors and activates the parathormone. Okay, now coming to a few of the investigations. Okay, so I'll not make you bogged up कि क्या है करके. Remember, there will be few questions जहाँ पे आपको याद करना है. You have to remember them. This image is from Lugol's chromoendoscopy. ठीक है? This image is from Lugol's chromoendoscopy. I'll not put all the investigations at one day only because it will ultimately create some confusion. So I have put 5-6 today. 5-6 will be in the next class, and then 2-4 कुछ और बचेंगे तो we'll revise it. Okay, so this chromoendoscopy is used for the esophagus per se. Okay, and what mainly this is used for diagnosing the Barrett esophagus, any malignancies, GERD changes. ठीक है, तो remember this thing. Please see this image. ठीक है, there is something like corrosive copperish color type esophagus is seen. Somehow try to correlate and remember the answer. Okay, so that's how you have to remember things. Let's move to the next question. The answer for this is Lugol's chromoendoscopy. Chrome से color कुछ ऐसा like just related, something related to chrome. Okay, move to the next question. Okay, this image has not been asked, but the question has been asked. Just these three images. I could not find any colored image. वो उसके paper में भी इसको black and white only they had given. Okay, they're asking identify the procedure principle of NBI. Mention one use in ENT, one use not ENT, and classification. इसके use का क्या classification है? Okay, so guys, what is the procedure?
Narrowband imaging.
Exactly. Okay, so whenever you are not getting answer, देखो अगर आपको पता है, great. If you are not getting the answer, look through that question. You might get some hint what they're asking. Try to relate the 4 points. You will get some or the other hint. So when they're asking something about NBI, तो procedure भी अगर कुछ नहीं पता है तो it will be NBI only. Okay, remember this thing. Okay, यहाँ पे sorry. So for NBI, basically you have to remember 3-4 points only, not much. From image, you should be able to like go ahead. This is NBI. You should remember there's something 2 wavelengths. This is 415 nanometer
and 512.
540 nanometer. Okay, like you might have read 512. Little bit variation is there. Whatever you are reading in the book, go ahead with that. Yeah. This is the blue. ठीक है,
इंजेक्शन
540.
ते सप्टेंबर मध्ये नाही, ते वेगळं इंजेक्शन होतं बोटॉक्स.
This is for the superficial part. Blue is for the superficial part, and green is for the deeper part. Okay, so just remember this. This will help you in differentiating both of them. ठीक है, and यहाँ पे it is based on IPCL. What is IPCL? IPCL is basically
intraepithelial papillary capillary loops.
Yes, doctor, absolutely correct. This is intraepithelial papillary capillary loops, and the name of the staging is
NI staging.
NI staging. ठीक है, this is the paper from where I've taken the images. See, this is of similar kind, and this is the name which I could find.
Staging.
NI classification. Okay, not from Scott, one of the ResearchGate publication. Okay, now this question I think last 22 से लेके अब तक thrice it has been repeated in multiple other formats. You would have also seen this thing. So please help me with A, B and C. Anyone?
C is Skeeter.
C is Skeeter. यही मेरे को भी आता था. ठीक है. So A is guys perforator.
B is burr.
Yes, this is burr. And if you want to go more into it, the name is Larkin's hand burr. ठीक है, so please remember it. This is important. ठीक है, this is very important. I'll say not important, very important. Skeeter, Stapes instrument, Stapes surgery complication, Stapes procedure. It's one of the most important sections that you will deal from the otology. तो जब भी आप ऑटोलॉजी रिवाइज करने बैठते हैं, स्टार्ट फ्रॉम these things only. Important point. After this question, I'll just again enumerate what are the important points from the otology. Okay. Now, they name the surgical procedures where they are used. We are clear with that. Stepedotomy के लिए use कर रहे हैं. Now, mention the no contact tool for performing this procedure. अभी पढ़ा first.
Narrow band imaging.
Narrow band imaging?
नहीं, non-photo laser. Laser.
ठीक है. This was something. हाँ जी. Any other input apart from laser? नहीं ना? ठीक है. So laser is the answer. Okay. And exactly to be specific, there is CO2 laser. Okay. So there's last question is enumerate 4 intraoperative complications. So can somebody would like to take
facial nerve injury?
Yes, facial nerve injury, chorda tympani injury. Anything else? SNHL होगा बिल्कुल. Facial nerve injury, chorda tympani injury, then ossicular chain disruption. ठीक है. Floating foot plate also you can mention the name. Apart from that, then perilymph gusher can come. Perilymph gusher. ठीक है. 4 पूछना है, लाइक उतना ही लिख देता है. ठीक है. ओके. सो गाइस, जब आप ऑटोलॉजी पढ़ने बैठते हैं, whenever you are going for otology, otosclerosis most important type है, followed by the entire stapes surgery here only. ठीक है. stapes surgery, this is important point. Second is your sudden sensory neural hearing loss. You will get questions on intratympanic steroid injection from this section. ठीक है. Then after sudden SNHL, you should remember the superior semicircular canal dehiscence syndrome. Superior semicircular canal dehiscence syndrome or the third window syndrome. ठीक है. यहाँ पे they will ask you what is the gold standard for investigation. They'll give you image of HRCT. They can give you. They'll ask you what is the type of hearing loss seen in this. So this you will have to answer conductive hearing loss. And last में Scott Brown में they have mentioned some operative techniques for this third window syndrome. वो तीनों नाम पढ़ लेने. ठीक है. And apart ये पढ़ने के बाद then go for the Meniere's disease. So go this way. You can follow whatever you want. My suggestion will be revise this way. ठीक है. उसके बाद you can keep on adding. अभी इसमें implants add नहीं किए हुए. This is like general otology. ठीक है. Moving to the next question. Identify the procedure being performed. So laser का चौथा question है आज का. ठीक है. So this is your stapes foot plate perforation by using CO2 laser. ठीक है. Taken from this PubMed publication. Okay, placed it over here only. Okay. Because the problem is these kind of images they give it in the exam. Operative image, out of 20 questions you will get 2 to 3 questions which are like operative images. They'll give you some image from some of the surgery and they'll ask you some questions. Okay, so like I'll not tell about anyone else. This is my personal experience. Like till the 3rd year, while I was like preparing for the OSCEs and all as a resident, many a times it happened कि surgery में यही समझ में नहीं आता था कि like this is from otology or laryngeology or rhinology. But this used to happen with me. Okay, so like try to train your brain in such a way, है ना, कि if this image is likely to be asked, so what all possibilities can come. Okay, so this is an important point. This can be asked to you. Okay, moving ahead. We have 10 more minutes. Please bear up with me. Now, coming to few of the other boring investigations. Identify the procedure which is being performed and what is Talbot's law. तो अगर आपको image देख करके you are not able to gather what is being asked. हाँ जी, answer.
Video laryngoscopy.
VLS बोल सकते हैं. Exactly, it is stroboscopy. When they are mentioning about Talbot's law, so it cannot be anything else apart from stroboscopy. I have kept 2-3 images which are similar. ये है HSDIA. I have placed all of them together. See, if you want to remember by the image, by the procedure per se, that is pretty okay. It's up to you how you are grasping. But if you get confused by seeing the images, please remember Talbot's law. If they are asking, it is stroboscopy. This is important. And what is this Talbot's law? Talbot's law बोलता है कि image on retina. Just a minute. Image on retina lasts for 0.2 second after the exposure. So based on this, they are having this and they might ask you what are the uses of stroboscopy. So let's see it here only. ठीक है, तो uses में it sees the symmetry of the vocal cord, then it sees the glottic closure. This is the specific names जहाँ पे पेल नहीं मचा सकते हैं. So you have to remember these exact names. What is the symmetry of the vocal folds? Glottic closure, amplitude and mucosal wave. Amplitude and mucosal wave. ठीक है? So if you remember these 3-4 points, your Dr. Sir, why not? ठीक है? So if you remember these 3-4 points, that what is the name? 1, Talbot's law. 2, what if Talbot's law? And चौथा हो गया, what are the uses of stroboscopy? This stroboscopy thing will get completed. Few of the other images are here. This is the 360 degree mucosal wave. How it closes entirely. These things are given. Achha, remember one thing. They might ask you these things as a GIF or a video based question also. Okay, so एक दो बार इसको same thing please put on YouTube and see the videos also. I'll share the link कि ये 2-3 videos please see, it's a must. So apart from stroboscopy, अच्छा यहाँ पे खाली छोड़, ठीक है. One more, one image, 2 image, ठीक है. Now अभी don't answer stroboscopy छोड़ के you can answer anything. You might be wrong but that is okay. But if they are asking in the second part, what is the difference from stroboscopy and still you answer stroboscopy, तो फिर वो गलत हो जाएगा. ठीक है. So the answer for this is HSDI. HSDI. The full form for HFDI is high speed digital imaging. ठीक है. And how is it difference? Is that this is HFDI is a frequency independent visualization. Independent visualization of the vocal cords. Uses mota they all things remain same. Like people keep on devising new things in front of their own names, new papers, new things, new names, and ultimately the resident has to suffer by learning everything of them. Okay, so till the exam you pass the exam, please remember it. ठीक है. Use क्या है? This provides detailed biomechanics या vocal physiology. ठीक है. पूछे जाने वाले क्वेश्चन 2 है. Full form of HFDI they can ask you separately also. They can give it with the image, a video or GIF based question, and they can ask you what is the difference. So these 2 things you should remember. This thing gets completed. Okay. Now 2 easy one. Identify this and this is a cobblator and principle of cobblator is a must know. नहीं भूल सकते उसको. ठीक है. Yes. So you have to answer it. Anyway, you can answer. But if you like ask me how to put it, you can write it. Current is passed through the water or normal saline. So what happens? Plasma field. Yes, doctor. Sodium and chloride and they differentiate. And the ions which have been formed, they form a highly energized plasma field, as Dr. Sab rightly pointed out. ठीक है. Now this plasma field is responsible for dissolving dissolving the organic molecular bonds. You can put it in your own language, whatever you are answering, just थोड़ा सा उसको ये streamline कर लेना. This is an important question. Please remember it. All the powered instrument in ENT. I shared you one PDF of around 8 to 10 pages, है ना, of this cobblator, radio frequency ablator, thunder beat, है ना, cautery and all, उसको पढ़ना है, it is important, don't forget it. Instruments, you will get 1 to 2 instruments in your exam, you will get 1 to 2 drugs in your exam, you will get 1 to 2 acronyms in your exam. ये गलती नहीं करना है, ठीक है. And whenever you are reading your theory, see, नाम का practical है, ultimately it's theory only. ठीक है. So whenever you are revising your theories, start making your mind towards that angle कि इसको how they can convert it into OSCE and asked. Okay, let's move to the next point. This is an easy one, and after this we'll call it a day. Identify the device given below. What else biochemical test you can do apart from this? Third is give one difference between CT and MRI cystoscopy. Can somebody take a try? What it is? Something related to nose.
Electronic nose.
Rhinomanometer?
नहीं
Electronic nose है.
ठीक है.
Okay.
Rhinomanometer, I'll share the image. एक बार Google में type, absolutely different from that. ठीक. Electronic difference. So guys, from your this chapter rhino में CSF rhinorrhea is a important chapter, as is the JNA. ठीक है. Please read thoroughly about this, and in दोनों से भी ज़्यादा important is something, I'll highlight it over here. Till now I have not spoken much about it. AFRS. This is like absolutely dangerous question. You will definitely get one question from AFRS somehow or the other. Okay, so we'll see about this AFRS either in the next ये क्या बोलते हैं recent advanced question or in the rhinology section, depending upon how much thought we are getting. ठीक है, read about these three things. This is very important, and let's see what else they are asking from CSF rhinorrhea. Let's see. Okay, so they are asking कि और कैसे आप पता कर सकते हैं. You should remember these two names, beta-2 transferrin and beta trace protein. ठीक है, both the names you should remember. They will ask you either in OSCE only, or might be if your viva lands up somewhere that side of this can also be asked. So you should remember one advantage and one disadvantage of each. Okay, so you should know that beta-2 transferrin is also seen in aqueous humor. Important. Then disadvantages में the availability, not available at all centers, plus the cost. This is there. And beta trace protein में one thing that you have to remember that sir, this is beta-2 trace protein is a prostaglandin D2 synthase. This is the composition of beta trace protein, apart from the other question that this is the second most common protein available. These two things you have to remember. Now, third question they were asking is what is the difference between MRI and CT cystoscopy? ठीक है, image एक बार देखना. I'm sorry, I forgot to put the image of MR and CT cystoscopy. I'll mention it over here, and please see it once. Can somebody help with me? Help me any one or two differences? चलो मैं बोलता हूँ. देखो सबसे easy, CT is always better for the bony details. Not exactly applicable on this, but this is a generalized term. CT is better for the bony details, whereas MRI is generally more for the soft tissue details as compared to the CT. One.
MRI safe in children.
Yes, doctor. So I'll put the radiation safety over here. यहाँ पे आपको radiation का exposure है, यहाँ पे no radiation exposure. Third, CT is generally CT cystoscopy is an invasive procedure. This is a non-invasive procedure. And fourth thing, which is pertinent for this, that CT cystoscopy requires an active leak. Okay, whereas MRI में this is not an essential requirement. Active leak means that during that time the CSF rhinorrhea is currently occurring that time when this test is being performed. Not essential. So these 4 points you have to remember. Okay, and this is okay. So this is all from my side for today, and for tomorrow my request will be, I know nobody wants to work on Sunday. If possible, please read about these three things. One is functional MRI, second is parallel imaging, and then the sequences of MRI. इसमें खाली sequences of MRI में just remember the names. That is the full form. Okay, Fiesta. this has been asked 2 times. ठीक है, flare, it has been asked 2 times in main DNB question. I'm not putting the squid, GAPA, FIS, वो सब नहीं डाल रहा हूँ. These 2 have been asked. ठीक है, so if this time Fiesta doesn't come, one more brother of Fiesta will come. Okay, so read about these names, and fourth will be bold and spect. ये चारों आए हुए क्वेश्चंस हैं, ये उससे रिलेटेड क्वेश्चंस हैं. ठीक है, इफ यू गेट टाइम टुमारो, जनरली संडेज आर, if you get some half an hour, 1 hour free, please read it, else we'll put it in the next recent advances session and we'll see it. Okay, so this is all from my side. I don't want to bore you too much on a Saturday evening. You can go and enjoy. अभी तो है, and if any point is there, please let me know, and keep on waiting for the theory results. We still have time for theory result, because abhi yesterday your FMG exam was conducted this year, today only in fact. So you have some time before the results start getting declared. Abhi NB free hoga, फिर they'll keep on compiling and getting the result. So please don't wait for the last moment कि result आएगा फिर मैं पढ़ना शुरू करूंगा. मतलब that is absolutely ये, because last time you all know that DNB gave only 2 weeks, 15 days का time था, है ना. So if you are banking up on the last 2 weeks, तो फिर थोड़ा मुश्किल हो जाएगा. Before that they were giving 4 weeks, 6 weeks, 8 weeks, time was there. So keep on reading little bit. From next week we'll be jumping upon to the COMS commerce. Okay, so which is a must know type thing for you guys. Okay, I will be sharing what all to read. Okay, and anything from your side, please let me know. Drop me a message, else we'll see you on the class will be on Tuesday, and baki from these messages and all will resume on Monday. Any point from your side, please let me know. Okay, chalo, bye, good night, take care.